Hi everyone. I just wanted to reach out. I know that a lot of people have been struggling. So I am very proud to work with a bunch of very talented people at a crisis center in Montgomery County called Montgomery County Emergency Service. We are a local affiliate of the National Suicide Prevention Lifeline. I can tell you firsthand from the phone calls I've been getting that there's been a lot of increase in phone calls, a lot of anxiety, a lot of people struggling, and a lot of people feeling very alone. Um, like they're at the end of their rope, and there's a whole slew of reasons. Every day on the news, it seems like there's a new disaster or a new problem, and I can understand that. What I wanted to say in this message is that you're not alone. There is help available out there. There are people who are willing to listen and to try to help you. People are really struggling with finances or, uh, with mental health or drug and alcohol or in relationships or even just the routine, normal daily life, having kids at home 24 hours a day, 7 days a week, online schooling, you know, the and now that we've gone into a second round, it seems like a lot of people are really having a hard time with that. And I think it's important to know that it's okay, to feel not okay, and um, to not let that overwhelm you so much that you react in such a way that is going to be detrimental to your life, to the life of your family, your kids, or whoever. You're not alone. There are people out there. So I did put a little resource guide together so that you can figure out, if you decide that you need help, how to access it and where to go. Every county runs things a little bit differently. So I put stuff together for local Southeast Pennsylvania so that I thought that might be of help to you. If you ever have questions or ever want to figure out what to do or how to do it, you can always message me. I always am here to help and listen and try to direct you at least into the right place. So, uh, the national hotlines, the National Suicide Prevention Lifeline, again, I work for a local affiliate, which usually gets calls from 484-610-215-267. It directs you based on the area code of your phone, regardless of where you are in the country. It'll direct you to a crisis center based on the phone number you're calling from. And most of the time, uh, from my experiences, most of the time it's just people who are overwhelmed in the particular moment, and usually 10, 15 minutes, people talk things out, and things are okay. Sometimes we, end up directing people to where to go to get some help, and sometimes all people needed to do was just talk some things out. So that's available to you. Alcoholics Anonymous, NA. They have local meetings. Some of them are running meetings on Zoom now because of meeting restrictions and how many people can be in one place and concerns about spreading disease. These are phone numbers. This one's for Alcoholics Anonymous, the 1-866 number. Down here, the National Helpline. This is for drug and alcohol, where to find local drug and alcohol treatment. Again, some things are easier than others, but there's always help available. And again, that tends to be county based. So, and based on sometimes what your insurance, or if you don't have insurance, where to get funding to get to a care provider. This is the NA meeting locator, domestic abuse hotline, veteran suicide hotline, which also sometimes comes into the National Suicide Lifeline. Veteran suicide hotline sometimes gets you directed specifically into other people who have been veterans, so that veterans sometimes feel more comfortable talking it over with other people who have been through similar. That's available. Crisis services. In Montgomery County, again, I work for a crisis service. We're 24 hours a day, 7 days a week. All you have to do, if you're in Montgomery County, is you just walk to the front door, ask for an emergency psychiatric evaluation. We will evaluate you for inpatient mental health if you feel like that's what you need. Um, there's we handle the voluntary patients who come in, and we also handle involuntary, what they call 302 patients. We also handle the 302 process, so family members seeking to file seeking help for a loved one or a friend or a fiance or a sibling or whoever, um, and the person may be not able to seek help on their own. We handle all of that in Montgomery County. Also, we are also lucky in Montgomery County to have a vast array of services. There's no shortage of services available. Um, we have something called Access Mobile Crisis. They are available 24 hours a day. They will usually send out, if you call them and you ask for help, they'll send out a team of two mental health providers who will help crisis plan if you decide you need to get to mental health help or drug and alcohol help or maybe find outpatient. They'll help facilitate that process with you. They also run a homeless outreach service. That is not available 24 hours a day. It is available certain hours, usually, I believe, first and second shift. So it's around 7 a.m. to about 4 p.m. or maybe later than that. They run a warm line, which is a line that's people just want to talk. It's during certain hours of the day, 1 p.m. to 9 p.m., 7 days a week. It's usually run by other people who have gone through mental health issues. Every county has their own version of a warm line. Access Mobile Crisis also runs a text line. So you can text in if you want to talk to people through text and you don't maybe want to talk to them on the phone. In Delaware County, you can access crisis services through Crozier Chester Medical Center. They have an inpatient unit, but they can also evaluate you. They also evaluate children. They handle the voluntary patients and the involuntary mental health commitment. Delaware County also has a very nice mobile crisis team. And by the way, I should mention that all the mobile crisis services that are available are no cost. They're not going to cost you anything. And their goal is really not to bring you, they're not trying to push you into going into a hospital setting. Um, they want to try to work with you and try to help support you, if at home or so that you can keep on living your life as normally as humanly possible. Bucks County has crisis services set up in different parts of the county, lower, middle, and upper Bucks. Um, you can pretty much access them at Doylestown, Grandview, and Lower Bucks. They're run by really great people through Lenape Valley and Penn Foundation. Lower Bucks manages a mobile crisis as well. You can get in touch with them. I listed all the phone numbers. If you ever feel unsafe and you don't know what to do, you can always present to usually any emergency room and they will help get you to treatment. In Chester County, crisis services are through Valley Creek Crisis. They have a phone number. They do have a center that's in Exton, but they also go out to the hospitals in Chester County. Chester County Hospital has a great team of social workers who really work to help facilitate people getting into treatment, so be that mental health or drug and alcohol. But again, if you're feeling unsafe and you need to get somewhere now, go to the closest emergency room. There's Jennersville, Phoenixville, Brandywine has a mental health unit there, um, and where you can call this group through Valley Creek Crisis, and they can direct you where to go. Berks County Service Access Management handles all of their stuff. They have a mobile crisis, and again, you can go to Reading Hospital. They have a very nice pod next to the emergency room where they do all their evaluations and get everybody evaluated. And if you need placement, they can work from there. Philadelphia has what are called CRCs, or Crisis Response Centers. They are supposed to be geographically based, depending on where your area of the city you're in. Temple Episcopal, Einstein Medical Center, Friends Hospital, Hall Mercer. Used to be Mercy in Southwest as well, but I don't believe, do that any longer. They do have a special center for kids, and they do have ways to access drug and alcohol. I did put together a service list that'll give you a list of all the resources, phone numbers, and where you can find those places. Again, so this is our resources link. All of the resource links have access to food pantries, rental assistance, help paying your utilities, working through eviction, legal aid, child care, where to, and how to access anything in between, from mental health services to drug and alcohol services to you name it, these resource guides. So if you need the resource guide, feel free to just give me a message, text message me, and I'll be happy to send you any of the links so that you can get access to these. These are some more. This is Delaware County, Montgomery County, Philadelphia County. Um, Again, food pantries, shelter services, how to access shelter, domestic domestic abuse projects for all the each county programs, um, even finding emergent medical care, primary care physicians, and anything in between. So again, the message I wanted to really send out there is help is available. Um, do not feel that you're alone in this right now. You know, even if you become so overwhelmed, that somebody's always there to listen. Never has to escalate to something else. So make sure that you take care of you and and your family. That's got to be first. All right. I wish everyone a happy Thanksgiving. I wish you well, and be safe.